Hello, everyone, and welcome back to another episode of Oxygen Pharma, where we discuss different issues that matter to pharmacists and pharmacy owners in Ontario. I am Marianne Kyriakos, a lawyer who practices in Ontario, Canada, and who specializes in providing services to pharmacists and pharmacy owners in Ontario. Thank you for joining us. In the next few weeks, we will be discussing through different episodes the different issues that pharmacists and pharmacy owners are facing these days due to the COVID-19 pandemic. And today we have with us a pharmacist with much expertise in pharmacy and pharmacy operations. He will answer our questions in regards to the different issues that pharmacists are facing these days in operating their pharmacies. Mr. Dean Miller, who is the president of WHOLEHEALTH Pharmacy Partners, is with us today. Hi, Dean.
Hi, Marianne.
How are you? Thank you very much for joining us today.
Yeah, it's my pleasure. Thank you for inviting me.
Us just answer some of the questions that are on every pharmacist's mind these days. Thank you very much for being here.
My pleasure.
And so, Dean, to start off with, we keep hearing the term flattening the curve. What does that really mean?
Well, you know what? If you would have asked me this question probably 2 weeks ago, like most pharmacists, I would probably say that nobody would know what that even means.
Right.
Today, you know, it's become part of our vocabulary, and I think, you know, as a pharmacist and as a pharmacy leader, you know, a lot of people have reached out to say, you know, what exactly does that mean? And I think a lot of people think it means a reduction in, you know, the incidence of coronavirus.
That's right.
It's not that at all. Basically, what we're doing by flattening the curve, it's just a term that's being used by public health officials to really encourage people to practice social distancing, you know, work from home. You know, what that does is it decreases exposure. So people don't pass the virus on to each other. And what that does is it allows healthcare, you know, workers, first responders, you know, whether you're a paramedic, a doctor, a nurse, you know, a pharmacist, to limit the exposure and ensure that healthcare resources are there for those that need them. And when I say those that need them, typically those are people like, you know, folks that are in long-term care homes, retirement homes, people with chronic diseases that you know are the most susceptible to the COVID-19 illness.
And you mentioned access to health care. We're also hearing of certain patients stockpiling medications out of fear that the medications will run out. What do you have to say about this, and how can we help them just calm down a little bit?
Yeah, well, this is a really key issue for pharmacy and pharmacists out there because you know, going into this, no one could have anticipated the demands that have hit pharmacy in the last week, and specifically in the last few days, as you know, as things like Ontario declaring a state of emergency,
right.
You know, shutting down the borders. You know, these are things that, you know, have put the general public in a little bit of a panic. So, you know, whether you're a young individual all the way up to, you know, seniors in Ontario, you know, what's happened is people have sort of reached out to their pharmacist, and, you know, even though perhaps your coverage will not cover an additional supply, people are buying extra supplies. They want to, you know, stock up in fear of you know, how long this possibly could last. So the recommended approach, though, has always been, and it's been there right from the start, is not to stockpile. And in fact, our national association came out today with a recommendation for pharmacists to only dispense a 30-day supply. So, you know, even if you were coming in and you were due for a refill of your chronic med or meds, and typically you got a 3-month supply, what we're telling, or what most pharmacists are telling those patients is, let's restrict it to a 30-day supply, because, there's so much uncertainty, in this marketplace about stock and things. And there's been a ton of talk about, what does this mean 4 or 5 months from now? Because, it takes a while for the system to, to get product to market. So, things are a little tenuous today.
People are
the issue, I think, Marianne, going forward is that it could last for a while.
Really. And do you have a message for the pharmacists also, who, there's there is word out there that maybe some pharmacists also want to stockpile the medication to not run out, so that they have that medication for their patients?
Yeah, well, unfortunately, I don't think any of our distributors out there, whether it be, McKesson or LPG or Cold and Fresh, these are all common names to pharmacists out there. I don't think anybody sort of anticipated what would happen over the last few days with stockpiling. So as a result, we're faced with a situation where we've got a lot of critical medications already. They're already starting to run short.
Yeah.
So, in order to sustain, the system longer term, and that's obviously what we want to do, I think the more we comply with this 30-day order and ordering accordingly, it's hard to do because, you've got a patient standing in front of you who wants their medication. It's hard to do, but, the more that we all stick to that, the longer we're going to have a decent supply of medications in the system.
That's right. Sharing is caring. I see this everywhere, Dean. Everywhere I go, sharing is caring.
Well, that's a great term to wrap around for COVID-19.
Yeah. What about prescriptions and patients' prescriptions and the refills? We're hearing that medical clinics are closing. Doctors are seeing patients or talking to the patients on the phone, but not in person. How does this affect the pharmacists who need refills of medications as well as patients?
Well, I think there's two answers here, Marianne. I think the first one is that the pharmacists, that are out there. I mean, we do this every day. I mean, we talk to physicians every day, whether they're in the hospital or in their clinic. Those are the individuals that, make those contacts for their patients. That still goes on. And the pharmacist plays an important role in ensuring that continuity of prescriptions. Who knows at this point how long this is going to last? But I think people just can't get in. They can't get in touch with their physicians. The assessment clinics and things like that are just jam-packed. So, the access to virtual care, the access by phone to your pharmacist to, get them to help you out. And when I say help you out, I mean, it could be sort of an on over the phone, passive screening. It could be, how do I access, an extension of refills? And remember, pharmacists have that ability. We've never been tested like this before, but in order to kind of act in the full scope of practice that we have that ability now to extend refills, and pharmacists should not be scared.
Thank you, Dean, firstly, for being here today with us, and secondly, and most importantly, for just being part of an industry that is really at the forefront of this fight against this pandemic that will hopefully not last for long. Thank you very much, Dean.
Yeah, and thanks for inviting me, Marianne. I really appreciate getting the message out.
It's a pleasure. Thank you very much. Mr. Dean Miller, the president of WholeHealth Pharmacy Partners. And this concludes our episode. I hope that this was helpful. And please join us. We are going to be doing a series of different episodes where we will be discussing the different issues of the COVID-19 pandemic. So join us next time, and thank you for tuning in.